When you think of the NCLEX, what comes to mind? Many students think about dread, nervousness, anxiety, but these are all really negative feelings that undermine your confidence on test day. So instead, let's focus on actual positive attributes of this exam and boost your confidence. If your confidence is boosted, it will increase your focus. And if you increase your focus, you will be more engaged in the exam and you will get more questions correct. The NCSBN launched the current version of the NCLEX in the spring of 2023, and there are many things that I like about this current exam. First, it is a manageable length. The NCLEX is a computer adaptive test that determines whether you meet the level of minimum competency. The minimum number of questions on the NCLEX is 85, and the maximum number of questions is 150. Based on your performance, the exam will conclude somewhere between 85 and 150 questions. You can do that. You can stay focused for 150 questions. I bet that many exams throughout your academic career have been 100 to 150 questions, so you know how to do that. In addition, you will be given 5 hours to take the test. So if you were to get every single question on the exam, you would have a little bit over 2 minutes per question, and that's a lot of time to critically think. The other thing that I really like is that there are these new case-based question types that have been introduced into the exam. Students like these questions because they represent real nursing. You can click on the different tabs presented in the medical record and learn about your client. That is what you do every single day when you're in clinicals. So the process to you is very comfortable. The NCSBN when they have analyzed this new test, said that students are performing very strongly on these question types. Remember that the NCSBN is assessing your ability to recognize and analyze cues, prioritize a hypothesis, generate solutions, take actions, and evaluate outcomes. Here in this case study question, you have different tabs you can click on. The tabs in this case study include nurses' notes, vital signs, laboratory results, and orders. So let's look at what is happening in the nurse's note. The nurse is caring for a 38-year-old client newly admitted to the medical surgical floor with fatigue and dehydration. The client has a history of diabetes mellitus and has been insulin dependent for over 20 years. The client has undergone hemodialysis for the last 4 years for end-stage kidney failure. The client's skin is warm and dry to touch with poor skin turgor, and the mucous membranes are dry. The client reports feeling nauseated for several days and has not been eating or drinking. The client also reports several episodes of diarrhea. Labs have been drawn, but results are not available yet. So when you get a case study like this, you want to think about, okay, what are the cues that stand out in that case study? When I look at this case study, the cues that stand out to me are that the client has diabetes, they're insulin dependent, they have end-stage kidney disease requiring hemodialysis, they have had nausea and are not eating or drinking, and they have diarrhea. Now I have to really analyze those cues and determine, what do I think about those cues that have been presented? What are my concerns for this client? Well, I'm worried obviously about dehydration as an issue, possible electrolyte issues, and maybe even DKA. This is thinking like a nurse. We do this every day when we interact with our clients. These question types will be interesting and relatable to you. With case-based questions, there are also new visually stimulating question types. So instead of having an entire test that's mostly 4-option multiple choice questions or 6-option select all that apply questions, you will now have a test that is rich in variety. This variety will keep you engaged. And what do I say about that? If you are engaged, you are more focused. If you are more focused, you will get more questions correct. So let me just show you a couple examples of these question types. In this one, this is what they call a matrix This is what they call a matrix single select multiple choice question. This question would have a corresponding medical record for you to read and then determine if each assessment finding demonstrates whether teaching is effective or requires follow-up. This question type is called a highlight text question. Which assessment findings indicate that the client's fluid and electrolyte status has improved? Items in the text are tokenized, and you click on the ones that represent fluid and electrolyte improvement. This is called a closed drop-down rationale question. In this example, you are given drop-down menus and you select the best response. This question here is asking you to prioritize a hypothesis based on the client's laboratory results. There are many different types of new questions. This is just 3 examples. And you can look at these different types of questions in all of the different formats that you can expect to see on the NCLEX by going to NCLEX.com. And they will have a tutorial called the candidate tutorial. And it's a fun tutorial. It sends you through all of these different question types, talking about baking a cake and road signs. So it's lots of fun, but will really expose you to all the different question types you can expect on the NCLEX. Probably students' very favorite attribute is this next one, and that is that partial credit is now awarded on multiple response questions. Multiple response questions require you to select all answer choices that apply, and you can have up to 10 options. Multiple response questions can have different formats to include select all that apply, highlight text, highlight table, and multiple response grouping. In a multiple response item, you must identify and select all of the correct answer options. There can be one credited answer, there can be several credited answers, or all of them can be credited answers. Scoring for multiple response questions, use what they call the plus-minus scoring model. The student receives 1 point for each correct option selected. For each incorrect option the student selects, a point is deducted. The total number of points is the total correct minus the total incorrect. However, the minimum number of points for a question is 0. In other words, you cannot receive negative points. Here is a select all that apply question. In this example, 3 of the choices are correct and 1 is incorrect, so the student receives 2 total points. So knowing that this scoring model is a plus minus model and gives you partial credit, I'm hoping that that's going to kind of take the weight off your shoulders as you sit for this exam and you receive these types of questions. It's not an all or nothing. You're going to get credit for every answer that you select appropriately. So just relax, use your critical thinking, and select the correct answer options. You got this. The last positive attribute that I want to talk about is a big one, and it is that you actually do know what is on the exam because the National Council State Board of Nursing gives you the test plan. The test plan defines the nursing competencies that are tested on the exam. And every 3 years, the NCSBN evaluates the applicability of these 8 testing categories and determines if any changes need to take place. Currently, the test plan has 8 testing categories. Each testing category is assigned a percentage that defines the quantity of questions on the NCLEX that come from that category. So I'm going to walk you through these 8 categories and tell you some takeaways about how to apply the testing category to what you're learning in nursing school right now. So let's start over on the left-hand side and look at health promotion and maintenance, which is 9% of your exam. This covers developmental stages, health screening, and disease prevention techniques. Here is where you often see those maternal health questions and pediatric development questions. The next category is psychosocial integrity, which is another 9% category. This focuses on mental health disorders, coping mechanisms, and support systems. You have to understand therapeutic communication for these test questions. And what I like to remind students is that when you are talking therapeutically, you are using the 3 F's. You talk to a client with feeling, you're focused, and you are factual. The last 9% category is basic care and comfort, and this focuses on providing comfort and assistance in the performance of activities of daily living. So here I always tell students, reflect on all of those topics that you learned in fundamentals of nursing: assistive devices, mobility, immobility, nutrition. All of those topics in fundamentals can be found in basic care and comfort. The next category is management of care, and this is the big one. It's 18% of your exam. This focuses on directing and prioritizing nursing care. So here's where you need to understand scope of practice. What is the scope of practice for the RN? What is the scope of practice for the LPN, LVN? And what is the scope of practice for the UAP? The next category is physiological adaptation. It is 14% of the exam, and this is one of my favorite categories. This category I think of as your critical care course in nursing school. You need to understand fluid and electrolyte imbalances, hemodynamics, illness management, and medical emergencies. The next category is reduction of risk, which is 12% of your exam. And this category focuses on reducing complication, which includes recognizing changes in vital signs and laboratory values. Now, here's some exciting news about this exam now. Items that contain a numeric laboratory value will have the corresponding normal reference range with it. So although you don't have to have those ranges memorized anymore, you do need to understand what is that lab value telling you about your client. The next category is safety and infection control, which is 13% of your exam. And this one focuses on protection from hazards. So here's where you'll find those questions on transmission-based precautions, security plans, and restraints. And then last is pharmacological and parental therapies, which is 16% of your exam. And this will focus on the administration of medications and parental therapies. Something to note is the big three. All right. So the big three are the three largest test categories on the NCLEX. And that includes management of care, which is 18%, pharmacological and parental therapies, which is 16%, and physiological adaptation, which is 14%. That totals 48% of your exam. So just these three categories make up a lot of the test. So you want to make sure that you're doing really well and know content from all 8 testing categories, but adjust your prep time to reflect the importance of these 3 big categories. To get a deeper dive into the competencies covered in each category, you'll want to visit NCLEX.com and go to test plans. You can see now that there are lots of positive attributes about this test. The length of the test, case-based questions, stimulating question types, partial credit, and known test plan categories. So I hope you're starting to feel a little bit more confident about this exam.